Hello everyone. Today we will discuss about the male causes of infertility. In my previous video, I had discussed about the female causes of infertility. So today we will study about the male causes of infertility. What is infertility? Infertility means not being able to conceive even after 1 year of unprotected sexual intercourse. And the most important factor which causes infertility in men are the hormones. And before going to the causes, we must be knowing about the normal hormonal regulation of male reproductive system. And the total normal semen count is more than 39 million and is the average value. pH of the semen is 7.2. Hormonal regulation of male reproductive system. In this, the hypothalamus secrete gonadotropin releasing hormone or GnRH in short. GnRH stimulate anterior pituitary gland to secrete FSH means follicle stimulating hormone and LH means luteinizing hormone. FSH and LH then travels to testis inside the seminiferous tubules. Inside the interstitial spaces in the seminiferous tubule, Sertoli cells and Leydig cells are present. Sertoli and Leydig cells have their specific functions. Sertoli cells express functional receptors for FSH, whereas the Leydig cells express LH receptors. So, LH would target the Leydig cells, which will cause the Leydig cells to secrete testosterone. Then FSH and testosterone will target Sertoli cells to release ABP, means androgen binding protein. ABP or androgen binding protein promotes synthesis of spermatozoa or sperm. Sertoli cells also secrete a hormone called inhibin. Inhibin stimulate anterior pituitary gland to decrease the production of FSH to control the sperm production, because sperm should be in a normal level, not more than that, not below than that. The most leading cause which is causing infertility in males in nowadays is the increased paternal age, because after the age of 40 years the production and the motility of the sperm decreases, which also causes chromosomal abnormality in the coming offspring, and the most common chromosomal abnormality is trisomy in chromosome number 21. And there are also many other causes which causes infertility in males, such as pretesticular causes, testicular and post-testicular. And about these causes we will study in our next slides. Pretesticular causes. Pretesticular causes means what is happening before coming to the testis. In the central nervous system, the hypothalamus secrete GnRH. GnRH means gonadotropin releasing hormone. GnRH is the hormone which stimulates the anterior pituitary gland to secrete FSH and LH. So due to decreased GnRH hormone, there is decrease in FSH and LH secretion. So this is known as Kalman syndrome. So due to decreased FSH and LH, there is infertility is occurring. So the treatment of this Kalman syndrome is done by hormonal supplementation of FSH and LH. Testicular causes. Testicular causes means what is happening inside the testis that is causing infertility. And the most common causes are, if a man is a patient of Klinefelter syndrome or he is having 47XXY chromosomes, or if any injury has occurred to the testis, or if any tumor is developing inside the testis. And varicocele. Varicocele means varicosity of the scrotal veins, means the scrotal veins has become dilated, and due to dilatation of the scrotal veins, the blood flow increases inside the scrotum, which is causing increased temperature in the scrotum. And due to rise in temperature, the sperm production and development decreases, because the sperm require less temperature than the normal body temperature to develop. And the normal temperature of the scrotum is 35 degrees Celsius. And this is why the scrotum are present outside the body of a male. And these testicular causes are mainly irreversible causes. Post testicular infertility. In this type, the most common causes are infection. If a man is having any infection since a long time, can lead to infertility. Second is globospermia. It means big round head of the sperm. In cases of globospermia, the sperm will not be able to fertilize. And third is blockage of the vas deferens. So these are the three most common causes of post testicular infertility. And treatment of post testicular infertility is, it is done by taking out the sperm directly from the testes and using them in artificial reproductive technique. Environmental and occupational causes. First is heat. If a man is working or living in a very hot climate, then there are chances that he can become infertile because the sperm require less temperature to grow. And x-rays. If a man is continually exposed to radiation. And third is smoking and alcoholism. So this was a quick discussion on causes of infertility in men. So thank you.